Its creator, Edward J. Harms, founder of Talladium Inc., explains.
How was the idea of Tilite started and its connection with NASA?
The idea of Talladium being developed by NASA started with my family and friends being involved with NASA. Their background in developing superalloys for NASA gave me the idea to bring them aboard the Talladium company to develop a superalloy for porcelain fused to metal in dentistry. The requirements and design were that the alloy must biologically be perfect, cast with extreme fluidity, and have a massive bond strength with the porcelain, and have coefficients to align with various porcelains on the market.
When was Tilite created and how was it introduced to the U.S. market?
This idea started in 1978 and was fully developed in 1980. The next phase was to do our due diligence with universities. First, we went to the University of Minnesota, a postgraduate school of prosthodontics, and had extensive research done and published on bond strengths of Tilite. Next, we went to the University of Boston to have research on oxides and its effect on ceramic color of the porcelain. Then we went to the University of Iowa and had biological research done by having Tilite implanted into animals and compared to a 14 karat and an 18 karat crowning bridge gold. Again, the results were extremely favorable. In between, we worked with the University of Southern California on castability, and using Tilite, we were able to use it up to 3 times without changing the target chemistry and adding no fresh metal to the melt.
What is your current Tilite positioning in the United States?
After our proven research was done with the universities, Tilite grew to be the #1 base alloy in the United States for ceramic fused to metal restorations. Incidentally, at the present time, we have over 125 million units in the oral cavity worldwide.
We have realized the market is concerned about nickel. What could you say to the Tilite alloys concerning this issue?
There's always been a concern about nickel in alloys for dentistry. This is why we went to NASA for help. They were able to teach us how to combine medically pure raw materials into a perfect metallurgic compound. We started by designing from scratch an electromagnetic furnace with 5 thermomagnetic mixing chambers powered by the largest source from Boulder Dam. Distilled nickel, which is actually bringing nickel up to a liquid, then a vapor under controlled atmospheric conditions, and then cooling back to crystal form, was combined with the titanium to form a complete compound that tied the nickel up and did not make it available to the chemistry of the oral cavity.
What are the main differences of the Tilite to other products of the market in respect to being non-allergenic?
Because we were able to fully compound medically pure elements, this gave us an alloy that was far superior to any other base alloys on the market in regards to non-allergenic response in the oral cavity. To this day, Tilite has been perfect in respect to any kind of allergy in the oral cavity.
What are the main advantages of working with Tilite with titanium alloys?
The major advantages that dental laboratories has in using Talladium's Tilite with titanium are that it can be used with titanium implants with no galvanic action. Its design and function is to absorb heat the same way as porcelain, making it highly compatible material with multiple porcelain firings, eliminating stress and strain with the porcelains and metals. Its fluidity and strength gives it an advantage of being able to cast twice as thin as other alloys, thus eliminating a lot of labor in finishing the alloy after it is cast. Thank you.
Tilite titanium is the basis for all parts TE markets, a new concept which, thanks to its unique properties, is the alternative to precious metals, the key element that ensures the effectiveness and quality of our parts. This innovative and unique product is a result of a joint effort between Talladium Inc. USA and American Aerospace Agency NASA, which meets all quality controls as it is highly biocompatible with living tissue, a medically pure alloy. The purity of the resulting elements is 99.9% and improves on all previous ceramic alloys. It is an anti-allergic alloy which does not produce galvanic reactions, acts as thermal insulator, and has no magnetic properties. It is 100% reusable, has a greater fluidity during casting, and a controlled oxide formation. It is compatible with all ceramics and has the lowest specific weight in the market at 7.7. Several prestigious universities have demonstrated the quality of Tilite, supporting its beneficial properties. Boston University. The material resulting from combining Talladium Ceramco 2 showed a significantly higher bond strength than the combination Olympia Ceramco 2, indicating that Ceramco 2 has a higher coefficient of compatibility with Talladium. Iowa State University. Only the Crown and Bridge 18K alloy could be biologically compared with a Tilite alloy. The Crown and Bridge 14K alloy was not on a par with Tilite in 18 different categories, from allergies to stomach scars. University of Dayton. No impurities can be found in Tilite. All metals used in the alloying process have been completely homogenized and processed into a chemical compound. University of Minnesota. The excellent grip and compressive strength of Talladium alloys proved to be 30% higher than those offered by the best precious alloys and more than 2 times higher than most metal-based alloys tested to date. Tilite titanium is backed by ISO 9002, the European Community, TÜV Rheinland, FDA medical device implantable in the body, ADA American Dental Association certificates. Tilite titanium is the only alloy covered by a $5 million insurance policy to protect the patient, the doctor, and the prosthetist. An example of this quality assurance is the more than 125 million odontological restorations completed throughout the world without any biological problems. Tilite Titanium and Talladium International, a sure bet. Talladium